Many scientific studies have looked at the benefits of exercise to reduce the risk of developing arthritis. And for those people who already have arthritis, exercise can help reduce their symptoms. And I've reviewed many of these studies in other videos. An important question is how? What are the biological mechanisms through which exercise can reduce and prevent the risk of developing arthritis or improve the symptoms? In this video, I'll review how exercise helps improve the health of cartilage. Hi, I'm Dr. Edmond Cleeman. I'm an orthopedic surgeon here in New York City. I specialize in sports medicine and arthroscopic surgery. In our joints, there's a smooth cartilage coating made of collagen mostly, and that helps protect the bone underneath. In arthritis, there's a degradation or breakdown of this cartilage, so there's no longer a good protection of the bone and pain can ensue. In addition, there's often inflammation and swelling and even contractures of the joint that limit range of motion, cause stiffness and pain. Exercise improves cartilage metabolism, meaning the health of cartilage and the processes of cartilage. For example, there was a study that looked at people who had arthritis and those who do not have arthritis in their knee. And they saw and studied what happened after those people did exercise. And they looked at the biomarkers, meaning things that they find in the blood after these people did the exercise. And here's what they found in those people who did not have arthritis yet. They found evidence of increased collagen formation, so that's good for cartilage. They also found evidence for decreased degradation, meaning there's less breakdown of the cartilage. And they also found improved structural integrity. So here we see that exercise in those people who do not yet have arthritis has all these benefits for cartilage. And so therefore you can see it would be really important for people to do exercise to help prevent the risk of developing arthritis in the future. Does exercise increase the volume of cartilage? So that would be great for the joint if we can have more cartilage. So the answer is yes, exercise does increase the volume of cartilage. In an Australian study of about 300 adults between the ages of 30 to 40, they looked at MRIs of these people's knees to assess the benefits of exercise on cartilage. And what they found was that moderate and vigorous exercise were positively associated with cartilage volume, meaning more exercise at a higher intensity was associated with more cartilage in the knee. Now, similarly, in another study that looked at children, they found that those children who were involved in vigorous exercise had almost 25% greater cartilage volume than those who were sedentary and not exercising. So you can imagine that for younger people, being physically active and being involved with exercise is again protective and helps build up more cartilage. In our joints, we have a natural lubricant. It's called lubricin. And this is like WD-40 in our joints. It helps make gliding on the surfaces better. Now, in patients who have arthritis, there's less lubricant in the joint, which will create more friction between the cartilage surfaces, which can lead to more breakdown, more degradation of the cartilage in the joint. In laboratory studies of rats, they were able to show that older rats who were doing exercise had greater amounts of this lubricant in their joint compared to those that were sedentary. Although we can't directly compare rats to humans, it does give us some of the understanding basic science how being physically active and doing exercise can promote the cells and the cartilage in the joint to make more of this lubricant and help protect the joint. The muscles that surround the knee are very important for absorbing the energy and providing balance. And in patients who have arthritis, they are found to have weakness in their quad muscles. They're often found to also have a loss of muscle mass, some studies showing up to 12%. And the number of fibers in the quad muscle that are activated when patients with arthritis use it is also diminished by almost 20%, some studies have shown. These things combined will cause weakness in the quad muscle. How much weaker can the quad muscle get in patients with arthritis? So some studies have demonstrated up to 76% reduced eccentric forces in that muscle. Having strong quad muscles and muscles that support the knee are very important because they absorb the energy like a shock absorber. So in those people who do not have strong muscles, they will see more stress go across the cartilage, will eventually cause degradation and breakdown of the cartilage because they're seeing more stress. Whereas if they're stronger muscles like the quad, they can absorb more of that energy. Now, an interesting question comes up, a little bit like the chicken and the egg. What comes first? Does weak quadriceps or leg muscles tend to lead to someone getting arthritis, or if someone has arthritis, that leads to them having weak muscles? So the answer is it's a little bit of both depending on the situation. For example, there was a study of about 2,200 people, and they evaluated their quad muscle strength, and they looked at x-rays of their knees, and then they followed them for like 2.5 years. And they found that women with the weakest quad strength had a 66% increased risk of developing arthritis compared to those who had the strongest muscles. Now, similarly, there was another study that used MRI instead of x-ray, and they also found, similarly, that strong quad strength reduced the odds of developing arthritis by 60%. So here we have several studies that are showing us the same thing, that having strong quad muscles are important for preventing arthritis, and having weak quad can often lead to or increase the risk of developing arthritis. How much quad weakness will become an issue for someone? Is it just a little bit of weakness will tend to develop arthritis? Does it have to be a lot of weakness? And so there was a study that found that just 15% comparative weakness in muscle strength between those who developed arthritis and didn't develop arthritis. So it doesn't have to be that much weakness. So this again shows how important it is to maintain strong muscles. Let's wrap up this video and go over a few key points. Number 1, exercise improves cartilage metabolism. Number 2, exercise can help increase the volume of cartilage, which is protective against developing arthritis as people get older. Number 3, the lubricant in the joint can actually be improved, the amount of it, by doing exercise. And number 4, by doing exercise, we can improve the strength of the muscles around the knee, which are important as shock absorbers to reduce some of the stress that would go across the cartilage and therefore help protect against developing arthritis. Thanks for watching this video. I hope you found it helpful. If you did, please click the like button below and subscribe. I look forward to seeing you in my next video or in my office.